Yeah.
Right, cool. So thank you very much for the introduction. So I'm Jack. I am a final year medical student at Cardiff University. And landed my jobs. So if you don't know already, when you graduate medical school, you can go into the foundation program, and then you can do different routes, such as the academic or specialise. And I landed one of those jobs up in Yorkshire, and I'll be doing a neurosurgical rotation, which is something quite uncommon as an SHO, as an F2 doctor, as a junior doctor. But it will obviously strengthen my application to become a neurosurgeon at the end of the day. So that is a bit about me. Do you mind going to the next slide? Wonderful. So a bit about what I'm going to talk about. So I'm going to talk a bit about how to balance research within medical school, how to get into research and what I personally did, and then how to get the most of your time at medical school. So research is quite a difficult thing to get into whilst you're at medical school, and sometimes the curriculum which you'll learn at medical school does not reflect some of the research and wants to do. So you have to really get out there and ask. So my policy is, if you do not ask, you do not get. So what all the opportunities I had was personally by going up and approaching and emailing and everything. So contact is key. So I'm going to talk about what I did, how you should go about getting some research under your belt, and also how to make the most out of medical school. So could you go to the next slide, please? So yes, this is me. This is me presenting at an international conference. With focusing on hepatitis C, so which is a viral infection. But I really want to pursue neurosurgery. Neurosurgery has been something I've wanted to do pretty much in the back of my mind since like second year medical school. And it's a bit funny how I really got into it. So I traditionally wanted to, well, initially wanted to do infectious diseases focusing on tropical disease. So hence I went to the London School of Hygiene and Tropical Medicine, which is a big global sort of epicenter of infectious diseases and public health. You might have seen the COVID-19 pandemic, and Chris Whitty was educated there as well. So I wanted to get into the WHO, the World Health Organization, but sort of I had a bit of an epiphany that I wanted to really pursue something more with manual dexterity, something I could do with my hands, and I love infectious diseases of the brain and the spinal cord. So I did my dissertation in Oxford, focusing on African trypanosomiasis, which causes African sleeping sickness. And that really got me started into, I wanted to do neurosurgery. I really wanted, use people with quite complex infections of the brain and other functional conditions. So my aspirations pretty much is to complete my academic foundation, get a neurosurgical training post, which is very, very difficult in this country, and also try and get the most out of life, really, try and get as many publications, presentations, get my name out there, as I was very much the first person in my family to ever go to university, go to medical school as well. So actually, I'll be going to Oxford, John Radcliffe Hospital, to do my neurosurgical elective, which will be very, very interesting. And hopefully I will get some research out of that as well. Next slide, please. So yeah, my sort of research getting into it was very different. Like some people start from the get-go. Some people have got people, in family members who have pursued research. But for me, I didn't really have a clue when I was starting. I didn't have that sort of background knowledge of what I'm going to do. So first of all, in my medicine, it was very difficult. I came straight out of sixth form, went into medicine, and I was pretty much clueless on the research publications, what I wanted to do. So year one was a bit of a blur. At that time as well, I had two operations, which and I was also on quite strong painkillers. So it was very difficult. I struggled during my first year of medicine, but again, I passed everything quite well, and I really, I got through it through some difficult times. So when you talk about resilience in medicine, it is vital. It is you have to dedicate what you want to do, and you have to focus. So it didn't beat me. These, and these operations and everything else which happened during that time, that did not beat me. So in second year, I knew I wanted to go elsewhere for my intercalated degree. In Cardiff, they only allow a certain percentage of people to externally intercalate. So I think it was only like 10 places to do so. So I was one of them, thankfully, and I wanted to pursue something specialist because it wasn't offered to Cardiff. So I wanted to go elsewhere. During second year, I obviously did well in my exams, got top 20%, and then I went to do a fully funded research placement up in the University Hospital Wales, which, if you know Wales, it's the biggest hospital in Wales. And I focused on something called Legionella pneumophila, which is a bug which causes Legionnaire's disease. And I did that for 8 weeks solid. It was, culturing, pouring plates. It was everything which I sort of wanted to get into. And then I was funded as well, so I got some money on the side, like a stipend. Third year, I knew I wanted to go for academic foundation. It was something which my old colleagues in the above years were going through, and they really wanted to pursue an academic career, which is what I sort of want to do. I want to get into surgical academia. So I knew I wanted to do that. And if you know the system, you can know how to get those points. So I knew I needed publications, I knew I needed conferences, I knew I needed academic prizes. So that's where I started. And then I thankfully got into the London School, which is quite competitive school, and I did a master's. So sometimes you can integrate 3 years of medicine, which counts sort of as a prerequisite entry requirement. So I then got into the London School and I did my master's. Don't take it lightly. A master's degree is full on for 12 months. So I didn't have any break pretty much. I did my dissertation through the summer, and this is when COVID happened. So everything was turned pretty much onto online learning. I had to change my dissertation to a bioinformatics project. It was very difficult, for a practical degree, everything online, which was quite hard. And I didn't really get a graduation either, which is something I regret, but I got my master's and I'm very happy with that. Year four for me was very difficult. So during this time, I had quite a lot of health problems and I had to take an interruption of study. So I took a year out because I had to have big operations. And it was hard because I had to really recover and try in years which were younger than me. So I felt a bit student, but I had to, and I didn't let that time off beat me. In the space of what, 5, 6 months, I got 10 publications and international conference. I got about 10 international conferences under my belt. So even though I was ill, I was resilient enough to get through those hard times and really got the academic achievements under my belt, ready to also sit finals, because in Cardiff, we sit finals in fourth year. And now I'm my last year. I am literally going for my elective in Oxford. I've got my jobs. I've done the dread 5 minutes later, and I'm really excited for the future. So pretty much my research journey, and this little pictograph basically says it's life does not go pretty much to plan, and you need to sometimes adapt, and that's where medicine is really vital, where you have to adapt, which is an important skill. Can you go on to the next slide, please? So yes, a bit about intercalation. If you're very interested in it, you can always discuss it after in the Q&A. But as I said, I got into London School. I did sometimes not routinely done because you usually do a bachelor's degree, but some institutions do masters. The only thing is be very careful financially because some of the funding it's a bit weird with the funding. There was a huge change from the medical degree. I had to switch back to writing essays and actually going through preclinical sciences, because back when I got into the London School, I was pretty much in my clinical years. So all of the physiology, microbiology, I had to relearn, which was very difficult. And kids on the course were not medical, they come straight from a degree. So they had all the prerequisite knowledge. So I had to really adapt to it, and it was quite difficult. But the perks was I gained such invaluable research skills, which I can translate into my future clinical progression. Just really be careful with intercalation if you're going for a master's, because it's very challenging. Next slide, please. So a bit about research. So I've talked about myself and my journey, but clinical research is how we develop new treatments and knowledge for better the evidence for new approaches that are safe and effective. Basically, what I want to do and what clinical research aims to do is to use bench to bedside translational medicine, sorting the stuff you got in the lab and then translating it into clinical guidelines and treatments and managements. Perfect examples would be immunotherapy, which have come from labs straight into like cancer trials, which is outstanding, really. And the COVID-19 vaccine is another one. So clinical research is really paramount to our everyday evidence-based medicine sort of approach. And if you're applying to medicine using those terms, based medicine, Cochrane, Archie Cochrane, who's really famous in getting evidence-based medicine started, those are the sort of buzzwords you can use in your interview to really express how clinical research is paramount to everyday clinical practice. So observational studies, researchers may collect data through medical exams, questionnaires, surveys, and follow up patients over time. And then clinical trials is your gold standard, where drug development or surgical intervention can be developed. Next slide, please. So examples of big clinical research in the past would have been the scurvy trial. So vitamin C is paramount to everyday, clotting and just well-being in general, physiological changes. So James Lind found that vitamin C was important for the treatment of scurvy, especially in sailors. So this was done in 1747. Birth control pills, which were done in the 1950s, contraception. Simvastatin, which is it lowers cholesterol, is very useful nowadays for cardiovascular disease and reducing the risk of, having a heart attack or a cardiovascular event. The child Pew score that is used in the prognosis, so a prognosis of chronic liver disease and cirrhosis, and finasteride, which is used for prostate cancer. Next slide, please. So why is it important? I've touched on it, but today's research is tomorrow's care. What you do in that lab and what you do, even if you think it's not relevant, it can be translated into your everyday care later on for the betterment of patient outcomes, etc. So clinical research may deem treatment options safe and effective. It may demonstrate whether treatments have any adverse drug reaction side effects, show whether new treatments are better than current standard treatments. Side effects being a famous example was thalidomide, which caused phocomelia congenitally, and that was paramount. Like, we used to use thalidomide for morning sickness in pregnant women, but found that it causes such congestion that through trials we got rid of it, and now we use thalidomide for cancer therapies. Address issues in current standard medical guidelines, auditing, quality improvement projects, which is something you're going to be doing later on, especially during medicine, and to get securing those competitive posts for your portfolio. Next slide, please. So why you should get involved. Getting involved in research early is both beneficial for your clinical and academic career progression. If you don't think you want to pursue a clinical career, it's still good to know these vital skills of research, because you'll be reading these guidelines, you'll be analyzing new treatments, and when you become a GP consultant, like whatever, you'll be reviewing the guidelines, which is based on evidence-based medicine. So you need to really, have research in the back of your mind. For me, medicine is to be a doctor, a competent doctor. It encompasses three things: the triad of attributes. One, to be a clinician; two, to be a scholar; and three, to be a scientist. So research is paramount. So research is also it's quite favorable if you're going for really competitive posts like a fellowship or an academic program. You can boost your CV. Lots of people in medical school get points through, publications, presenting at conferences, and such an amazing networking opportunity. So definitely get involved. Postgraduate qualifications: if you want to do an extra degree in medicine, it'll benefit your application. Get ahead of the competition for national job allocations. So, medical schools, just to start, you've got all these competitive specialties, especially surgery, where you're about to get attention for interview, for example. Gaining valuable skills and experiences you wouldn't necessarily get in medical school. You know, doing attachments, doing an extra degree, you learn skills which you could use if you get like a pathology rotation, etc. Influence tomorrow's doctors and healthcare professionals and influence the future of medicine. I don't do research just for points. I do research to really benefit patient outcomes, which is what you want to be aiming to do, not to just, you know, get extra points. You want to actually benefit people because at the end of the day, you're a doctor. Okay. Next slide. How to get involved. So even if you're applying for medical school, it's just good to have a, you know, the different study designs. So original articles, these are your trials, these are your audits. They're quite difficult to do. And you can get involved during placements in medical school. Reviews, very, very useful. This is something called a Prisma diagram, which you'll learn later on in medicine. It's just to see if you can review the current literature to get, you know, and treatments, etc. Case reports, you can, you know, if there's a very interesting pathology or with patient consent, you can actually go and present them and publish them to inform the wider audience about, you know, certain presentations, etc. And then let's say you can actually, you know, comment on articles and get your name out there by commenting on, you know, what's the problem with the study, what the editor should look into. So it's also very useful. Next slide. Personal tips for me. LinkedIn is a very useful social media for, you know, for networking and for professional reasons. I have a link account and I use it very well, and that's where I got a lot of opportunities. Do not overdo it. At the end of the day, you're going to be a doctor. You're not going to be, you know, you won't be you know, focusing all your efforts on research. At the end of the day, you want to benefit patients. You want to manage patients. You want to really have an influence and treat. And that's the whole point of being a doctor, not just dedicating, you know, to research. People do, and you know, it's not a problem. But for getting into medical school and for being a competent medical student, your core competences are vital. Taking a history, doing an examination, they are the most important things for you. Have a balance, you know, don't make it your life. I had time in my interruption study to really contemplate and get ahead, but don't, you know, don't let it suffer your socials or your you know, your friendships, your colleagues, etc. Don't let that, you know, don't let that impact, and do not prioritize research over your competencies. That's as I said. Conduct research on what you're passionate about. If you're doing something you hate, you're not going to do well in it. So do research and stuff you are interested in. For me, it's disease is psychiatry. So that's what I focus my efforts on. And do not research just for PubMed IDs. PubMed is the database of basically where you can search up articles. And to get points, you need an ID on those, like an authorship on those articles. For the time being, don't worry about it, but later on, it'll make sense. Failure is a learning experience. And the guy who has never failed has never done anything. So in research, you will fail. And failure is a part of life. So you need to cope with that and learn how to can I have the next slide, please? And that is me. So I hope it's been useful. I hope it's been insightful. Definitely ask questions in the Q&A. I'm open to anything. If anybody's interested in neurosurgery, let me know. But yeah, I'll hand it over to Kenneth.
Okay, thanks, Jack. That was really informative. I learned quite a lot as well from there.
Thank you.
My name's Kenneth. I'm a final year medical student as well, from Manchester. And like Jack, I'm also interested in doing a career in neurosurgery. It's quite odd that both of us decided to do this talk at the same time. Can I have the next slide, please? So I did a undergraduate degree in Queen Mary's before doing medicine. So I did that for 3 years, and I did biomedical sciences. So I think that's where a lot of my understanding and appreciation for research came from. But it wasn't until the latter years of my medical school years that I actually got involved in research, because you don't really get to do quite a lot in the first 2 years, mainly because of the way that the UK medical system is set out, where you do a lot of anatomy and biochemical study learning before you go into actually doing patient-centered learning. So as I said, I would like to do a career in neurosurgery, but with a focus on pediatric population. So that will be a long journey, but that would mean that I would be able to do research in both an adult and a pediatric population. And I've got to experience both of these populations in medical school, mainly during my 3rd and 4th and the current year I'm in. But I hope to eventually do a PhD in artificial intelligence, because that's unlike, so Jack seems to be more interested in a lot of the clinical research side with lab work, but there is another aspect of research that you can do, which you don't have to be so involved in a laboratory setting, but you can be involved in looking at patients' data, seeing the the correlations that there are with the data and patients' outcomes, and improving on it. And the field of artificial intelligence and a lot of technology is coming into effect in medicine a lot, primarily in neurosurgery, cardiology, and I think a lot of gastroenterology. There's a lot of the research being conducted in. So it's a quite exciting field to get involved in. And I think in the next few years, it's going to be something that will take over a lot of research. Could I have the next slide, please? Thanks. So as I said, in the first 2 years, I didn't really do any research. You don't really get a lot of opportunities to do it in medical in the first 2 years, because one, you're getting used to going from, let's say you go from year 13 to university or from a different degree. You kind of have to change the way you learn, especially if you're coming from a school environment, because you're no longer being spoon-fed. But also you want to get used to medical school in general. So you don't want to become overwhelmed by doing a lot of additional research. A lot of people I knew did do some research, mainly, as Jack said, like audits or letters to the editors, because those are things that you can do earlier on, and they don't take that much time. Audits do, but letters to the editors don't really take that much time to do. And a lot of consultants they will be willing to let you do research with them. But I don't want you to, once you get into medical school, if you are in medical school at the moment, just to try to rush to get a lot of publications done in the first 2 years, because you will realize that you might end up taking a lot of work, and you will fail to keep up to your clinical competencies, which is the reason why you're in medical school. The reason why you want to be a doctor is to provide for patient care. The research is just an additional thing that's there. So for me, in year 3, that's where a lot of research happened. Manchester has a really nice thing that they do, where they allow, well, not allow, but they make all medical students undergo a project period at the end of the year. And the amount that you do depends on how much you want to put in. Some people just did the bare minimum. That's fine. Not research isn't for everyone. But this is where I did quite a lot of research. And in 4th year, I took on that research further by getting involved in a lot of audits, my own research projects that I developed with a good mentor. And in 5th year, it's just something that I realized I wanted to do in the future. So like Jack, he's going to do the specialized foundation program. I had also applied for it as well, but I realized that the areas that I applied for are not where I want to be anymore. I want to stay in Manchester because that's where my research is taking off. So I've rejected those places and I'm just going through the normal foundation route, which is fine to do. And even if you don't do the specialized foundation program, there's still opportunities. You don't have to do that program. It does help. And a lot of researchers do go through that program. Could I have the next slide, please? Thank you. So this is a bit about the project that I did in 3rd year, which started everything. So it's initially a pediatric focus project, which was my first exposure to pediatric population, because you don't get a lot in medical school until you start your clinical years, usually in about the 4th or 5th year. That's when, well, mainly the 4th year, when you get exposed to that sort of population for a long period of time. But this type of research will make you aware what a bulk of projects involve, and that's data collection. And data collection is something that will take a lot of time, depending on how many patients you have and different parameters that you're looking for. It does make people get put off by research, especially in like the first 2 years, because it can take a few weeks, maybe a month or so to collate all that data and actually understand it. But it's important. It produces a database, which is what a lot of research uses. It's tedious, it's not enjoyable, but when you get the results, you can do so much with it. So you can, obviously you will have to analyze the data, and you'll be taught that during medical school. If not, you can learn it or get a supervisor to help you learn that. And it's just another additional skill that will help you not just in medical school, but throughout your academic career if you are going to do any research. So for me, I got to present this in San Diego. Obviously, this was during the last 2 years, so COVID kind of affected it for me to actually fly there. But certain projects will yield different results. So you can have a publication in a different, like certain journals, and different journals will have what we call impact factor. And ideally, as medical students, it's a bit hard to get a really high impact factor journal submission, because mainly they're submitted by consultants or people who are really high up in the field, and the projects that you produce won't be, they may be, but they won't be so significantly contributing to the field that you're researching in. But you can get presentations, both oral and poster format. And it's also good to have those under your belt, as Jack said before, because they are important for your applications that you do after medical school into your specialty programs as well. And these projects do take a while to do. Like this project took me from 3rd year, and I just finished it recently in September. But that's not how all projects are. Like, some of them can take a few months to do. It just depends on how much effort that you're willing to put in. And you're going to fail at points in projects. That's the reason why this took so long. Because with research, there is going to be failures. Not all projects go to fruition, and not all projects have immediate success. It just takes a lot of perseverance to finish it. But I think it is something that's worthwhile doing. Can you go to the next slide, please? Oh, you skipped one. Yeah. So as I said before, I'm interested in like augmented reality and artificial intelligence, more artificial intelligence than augmented reality. But there are, as I said, there are different areas of research that you can do. So mine is mainly a technology-based research. So how you can get about these projects in medical school, not just this in particular, but anything, is by speaking to people. It feels very scary in 1st year when you're in a hospital environment, or if you do get exposed to a hospital environment, to go ask someone. But consultants have a huge number of projects ongoing, most of which they can't do by themselves. So they will either give it to their registrars, or they'll try to give it to a different consultant. So that's your opportunity to go speak to them. Obviously, don't annoy them to get these projects, but they will be willing to give you these projects if you show that you have a passion. It's very easy. You just go talk to them saying that you're interested in this area of medicine, like dermatology or something. And if they have any projects ongoing or something that you can get involved in, you can do that on placements, just show your interest. And more than often they would give it to you. That's basically what happened to me. This was during my elective. You can do a project, but I just asked if I can do something that's not being done at the moment, because I wanted to get involved in novel research. I didn't really want to do like systematic reviews and all those. They're not boring. They're very important to do those things, but I tend not to like a lot of writing to do. So I want to get involved in a more active project. And so this is currently being done by myself, but also you can get to the stage in research where even as a medical student, you can have other medical students doing work for you. It's not unusual. I do have another friend who's doing this as well, but you can create a research group that you can delegate a lot of your research to, obviously under the supervision of your supervisor, and you can have a lot of ongoing projects. So I have about 10 ongoing projects that I'm not even writing at the moment, I'm just overseeing, but they're all eventually done by me. But that takes some time to achieve. It's not something you have to, just because I wanted to not be doing a lot of the data collection, because as I said before, it takes a lot of time, and in fourth year and fifth year, the time that you have for research is very limited, because of your exams and things. It's just something you have to try to balance, and obviously your exams and your clinical competencies will always come first, regardless of what level of research that you're doing. But something important to mention is that it's really good if you find a good mentor. So this is someone that will possibly share your interest in a specific area of medicine or research, and there will be someone that will push you to do more research, somewhere that you can present your ideas about research to them, and it really helps to develop your interest further. And I think that finding a mentor myself was what made me really want to do research in the future alongside my clinical career. So that's how I got into artificial intelligence, and I hope to just continue that for the rest of my career. Could I have the next slide, please? So yeah, as I was mentioning, so this photograph on the bottom is just something me and one of my friends who's on the left, my left, I guess, so we did this on a random night. We just made this idea and then we presented it to my supervisor, and now it's become a project that we presented in London. We're going to present in Austria soon. And we're trying to make a research team with the Children's Hospital in Manchester, Salford, and Liverpool Hospital to use artificial intelligence. So even as a medical student, you can do quite big things. And you shouldn't let the fact that you're a medical student put you off trying to seek these high-level things. Because I think people will be thinking that, oh, I can just do a systematic review and get the points. Yeah, of course you can get the points, and I think that's important if you're going to go towards a research career, to make sure you tick those boxes for those applications. But it's important to do what you are passionate about and to just continue, I think, striving for more, and just because research is tedious, but once you enjoy what you're doing, that tedious aspect of it just disappears. Can you go to the next slide, please? So research is fun. It does have some boring aspects of it, as I mentioned, but research is really fun. There's obviously some boring parts of it, like audits, where you're just looking at data and analyzing it, and it does get boring if you're constantly getting told this needs to be changed, or there's some aspect of it that you're not looking at. That's because it's hard work. Medical school, any part of medicine is hard work, and research is not different. And I think it's important to remember is that the outcomes of research are really, really good because you're contributing to patient care. Yes, you're doing it for your application and to become a surgeon or a consultant or whatever you want to do, but ultimately your research is improving patient care and patient management, and that's the main reason why you want to be a doctor. It's good to have all these research under your belt and to be like a professor or something, but to know and to actually actively contribute to patient improvement I think that's worthwhile doing research. Research isn't for everyone, and there's loads of people that just do maybe 1 or 2 projects and that's it, and that's fine. But I think it's important that throughout medical school, you'll be exposed to loads of different specialities, and I think it's good to not close the door on any speciality, and just try to get involved in a little bit, maybe just doing like an audit or even like a systematic review or a letter to editor or something in let's say, dermatology or oncology or something that you might not be initially interested in, but as you do it, you realize which parts of medicine that you might want to get involved in more. Like for me, I didn't even think about pediatrics until I did that big project before. And so like research, nothing, like anything, nothing worth having comes easy, and it's true for research. It takes a lot of work to do, but it's worth it. And I think Jack said to not do research just for the PubMed IDs. I think that's important because people do get fixated on that just to get a few points for their applications or for F1, F2, and then for their surgical post. Yes, it's good. I think you have to get those points, otherwise you're not going to get accepted. But the research that you do, I think, for me right now, it needs to be valuable, and it needs to be something that will actually help patients. Otherwise, I just don't do it anymore. I think that's how you should start with any type of research. You should think, is it going to contribute to patient care, and how can you actually get involved in that? But research is, research is something that you should do. If you should try, I think every medical student should try it. It shouldn't be something that you close the door on in first year, and your medical schools will give you a chance to be exposed to that at certain points. And I think when you do get exposed to it, you should just try to see which areas of medicine that you're interested in through that. Can you go to the next slide? I think that's the last one, actually. Yeah, it is. Okay, yeah, thank you for listening.
Okay, well, thank you so much, both Jack and Kenneth. That was really amazing to hear about your experiences. So I think we have some time for questions for both of you guys. So if anyone in the audience does have any more questions, just put it into Slido, and then we'll see how much we can get through. Yeah, Anna, do you want to start off?
Yep. Hi, I'm Anna. I'm also into part of Intermedical Events team. I'll just ask a couple of questions I've seen on Slido, starting with the most liked one. Kenneth, how did you develop your own project? What is the pathway of brainstorming, approaching supervisors, etc.?
Okay, it's a very good question. I've been asked that before by other medical students as well. So how I started it was, I thought of, you need to think of what condition or what area of medicine you're going towards, or what you want to research in. So like for me, let's say the project I was doing is looking at a specific cerebral vascular formation in a pediatric population. And then you want to see what's the problem with the current treatment or the current management or investigations that's being done. Once you can identify it, then you think, how can this be improved? Or how can you improve it? So for me, I realized the diagnostic areas of this condition is called moyamoya disease, but the diagnostic aspect of this is very limited. It's good, but it's not perfect. And then I think, how can I improve it from, let's say, 80% to close to 100? And then you try to see what skills you have right now. So for me, I had skills in a lot of coding programs, so I know quite a lot of Python. So I thought, can I develop something that can identify these findings in MRI scans better, not better, but to help radiologists, essentially improving the investigation aspect of the condition. And obviously, then you think about what's the final thing is, what's the end goal that you want to achieve? The end goal for all research, as I said, is to improve patient outcome. And then you try to make the connection between what you will do and how will that improve patient outcome. So for me, it was improving the radiological findings, and that will obviously improve identifying patients who have these findings, and then they'll be treated much earlier. that's not applicable to everything, but I think if you use that as a skeletal format for research, you can bring that to a lot of supervisors, and it'll be very obvious that you're interested in it because you spent that time outlining this issue and how you will tackle it, and they will help you. You're not just going to be doing it by yourself. They'll be there to help you and then refer you to people that can support you. I don't know if that helps. I was just rambling.
Yeah, thanks for answering. I think it definitely does help. Just moving on to the next one. Can a year 12, 16-year-olds find work experience in the lab if they're interested in doing more research-based medicine instead of traditional patient-based? If so, how? I think this is for Jack. Oh, Jack, you're muted. Sorry.
Is this for me? Is it? Okay.
Yes.
So
yeah.
yeah. So funny enough, I am a biomedical research placement in year 12 in Cardiff. There was like a week's taster thing where they basically allow you to go in like shadow biomedical scientists and see what they do. So the lab work, which as doctors we don't really see that much unless you've done like pathology where you're actually testing for things. So I got involved with PCR, which is polymerase chain reaction. You might have done any A levels. Got involved with actually I think it was injecting. I think it was injecting like mice ovums and stuff like that. It was really interesting, like with microsurgical needles and stuff. So there was a lot of stuff happening, which I got experience to, in like gram stain and those sort of things, which you will not do as a doctor. So sometimes these schemes are offered, they're like disseminated within schools, but other times, a lot of people I knew who got these attachments was purely word of mouth and who you know. So the way I got GP work experience was literally I emailed about 50 GP surgeries in Cardiff and one replied. So it's random luck sometimes with getting these placements, but there should be some schemes which you can like apply for, which you might get onto something. But that's what I did. I just got into a scheme and entered a week's taster. I don't know if it's different for you, Kenneth.
Yeah, I'm not sure if there are schemes available for lab-based, because obviously there's a lot of, I guess, ethical things that they have to like go through. Yeah. But I'm sure there are. I'll have a look, and then if I do know, I'll just send it to whoever will send something to the participants.
I know Cardiff definitely does one. So obviously with big institutions there must be something going on. You just got to find out in email, unfortunately.
Okay, yeah, thanks so much. I'm glad you just butt in for this. I think when I was applying for med school, there was something called Nutfield, and they do a lot of research, and there was a scheme. I didn't apply for it. That you guys could go look for it. I think it's only applied for year 12s because it's during the summer between year 12 and year 13. So year 13s unfortunately can't apply. But yeah, have a look.
Yeah, and remember these placements can be quite competitive, so don't be disheartened if you don't get it. It's not going to be a detriment to your application, I don't think.
Okay, great, thank you. Okay, so next one is how can medical students look for projects and get involved in projects? Cold emails? Question mark.
Right. Kenneth, do you want to go first, and then I'll give you my experience?
Okay, yeah. So cold emails, they don't work. They don't work in medical school because consultants, you think they have a secretary, everyone has access to their phones, they have access to their emails. That's not how hospitals work. Consultants are too busy to even respond to your emails. And it can be quite disheartening when you're sending so many emails and they're refusing to reply to you. I think the best way to get research experience as a medical student is to speak to them. When you're on placements, when you're in clinics, the best time is clinics. So, because you're just with the consultant or the registrar and it's just you. and then there's no other medical students there, so you don't have to, that aspect of being shy or if someone's going to judge you is gone. And if not, talk to other medical students that might have projects that they're doing and say, how do they get to? Because that might be another way that they've spoken to them. Universities do have societies that have like research societies and stuff that have projects that have been given by consultants to help. And I think that's a good way to start. I think Manchester has quite a few of them. I'm pretty sure Cardiff does as well.
So you're completely right. The cold emailing is just ridiculous. Don't waste your time. I mean, you can try, but you're not get much out of it. Best way to do it, as Keneth said, is literally whilst you're on placement. I follow a motto. It's called, if you do not ask, you do not get. Be cheeky and ask. See if there's anything happening. Is there case reports? Is there audits? Is there this? Is there that? If you do that on the first day as well, if you're in a team, the consultant is usually going to be nicer to you because it shows that you've done initiative. You've got, you've wanted to pursue something they're interested in. Consultants are interested in their specialty and specific parts of their specialty. So show interest, show motivation, and then you'll probably get something out of it. The other way I did it, because I don't do much in Cardiff actually, I sit on a lot of committees. So the Royal Society of Medicine, there's a student section I sit on. I'm the academic chair. I'm like a co-director of a research institute, which was, I don't know, it was very it was something I didn't expect happen, and I managed to get it. So I do a lot of research from that point of view. And big committees, even your surgical societies or university societies, is all about networking. And I abide by LinkedIn. If you have a LinkedIn account, it is honestly, it's changed my perception of social media. You can get a lot. Most people are active on LinkedIn, especially like academics. So if you message someone on LinkedIn, you can direct message, like asking, attach your CV, whatever. If they don't respond, they don't respond. But most of the time that I've had loads of responses. So I've managed to get lots of projects just from that. So LinkedIn is number one, and number two, if you do not ask, you do not get. Utilize every opportunity you have.
Yep, brilliant. Thank you. Next question. Give me a sec. Oh, I've lost it. Oh, there it is. How should a Year 12 student learn about current medical research/news? So this person has an interest in genetics and would love to learn more on genetic research and discoveries.
So for me personally, I'm not that interested in genetics. It's one of the things I'm quite scared of, actually. I don't, it goes way over my head as a simple microbiologist and surgeon, aspiring surgeon. But I mean, some institutions, like I know for Cardiff, they're very big on genetics, like Huntington's disease and neurogenetics. So again, like it's pretty much asking professors who've got an interest in genetics and seeing what's about. I'm not really, experienced in genetics, to be honest. Keneth?
Yeah, I think when I was in school, what I looked for was, it sounds very basic, but you can just Google genetics research news, and one of the main websites, I think it was like Medical News Daily or it was something like that. So they have very broad topics. It doesn't have to just be for genetics, and that can give you like a very basic understanding or exposure to what the current research is. I don't think at this stage you need to, like when you're year 12, you don't need to be reading articles. You can if you want, but you're welcome to. But I think that's probably just using like Medical News Today, or I think Science Daily also has some good ones. Yeah.
I think just to add to that, so I'm a medical student as well. When I was applying for medical school, I managed to go to a lot of talks that universities were running specifically for year 12s who are interested in applying for medicine or even just in science in general. So I know Newcastle University, they do like, I think they call it mini medical school. So they run a series of talks, I think both online and in person. So those are really interesting. So just have a look literally on any university website for year 12 opportunities. And if you're interested in more of the science side, don't limit it to just medical school or like applying for medical school. Go into bioscience, biomedical science, biochemistry, all of that, because all of that you can talk about in your personal statement as well. But there's plenty of free events that you can look into. And sort of linking to what the guys were talking about earlier with Nuffield, if you want something more genetics based, I do know that Oxford, they do a summer school, so Unique. So I did that when I was in year 12. But it's not just medicine that they do. So it's a 1-week summer school. They do like biomedical science, and I know you do a bit of like genetics and other biology related stuff. So there is a lot of opportunities, but the key take home is do your research. Like, just spend so much time Googling stuff, because you will find a lot of local opportunities as well. So I know so I'm from like Middlesbrough. One of the like local places, they do a science cafe. And I'm sure a lot of other places do that as well. So people come in and talk to the public about research and science. So that's something worth like looking into as well. If not, documentaries are always a good place to go into. There's plenty of like medical discovery type things, which again, you can talk about in your personal statement and things.
Yeah, sorry, just to add on as well, I remember when I was applying, I did a couple of like Cambridge masterclasses. I don't know if they do them anymore, but they were very, very popular. Loads of people went to those. And so have a look for that as well. But the Unique Summer School is a good shout. It is competitive though, and I think it's based on GCSE grades, to be honest. So just have a look around.
Brilliant, thanks so much. Just moving on to the next one, I think. So how do you use LinkedIn to find opportunities in research?
Oh, this is me. Okay, right. So LinkedIn, I should be a salesperson for LinkedIn. It is literally, so make an account. Pretty much it's your online CV for networking. Put everything you've got, which you've done, in it. So if, for example, if you LinkedIn my name, Jack Wellington, then there's like, I'll literally have my CV. It's literally my online CV. So then you have to try and get a follower basis. So the more followers you have, the more likely. So just literally you can follow your friends, follow colleagues, follow your professors, your supervisor, whatever. Just keep add. And then what I did was I knew I wanted to do neurosurgery. So then because I sit on committees, I knew certain people I should link my, so I should follow. And then I messaged them privately, basically saying, look, here's my CV, whatever, have a look, have a gander, see what I can get involved in. And then most of the time, no replies, is just like leave on red. But sometimes, I've been, into research groups and I do a lot of editing work for publication. So it's honestly, if you do not ask, you do not get. So make a LinkedIn, follow people, and hopefully message people you're interested in working with. And, that's how I did it.
Yeah, I can't really add to that.
It's all about, you have to ask and you have to be cheeky. Just because you're a medical student doesn't mean you can't get involved in big projects. I mean, a famous example was back in, I think, the 1890s, a guy called Paul Langerhans was a medical student. At the time, he discovered the islet Langerhans, which produce insulin. So he was a medical student. Along with insulin, one of the, I think Collip or Charles Best was a medical student, or like a biosciences student. So it's inspired to read these people's biographics and see, like, as a medical student, they discovered this. It's honestly, just really try and get your name out there. It's the best thing you can do.
Right, well, thank you guys. So I think we'll move on to some of the questions that people sent in before the webinar. So there is one that's specific to you guys, not just research, but so someone's interested in a career in neurosurgery. What books do you think they could read?
Okay.
Go on, Kenneth, you go first.
So I think if you were interested in it, I would say, like, if you're in year 12, year 13, to be honest, even if you're in first year and second year, don't read neurosurgery textbooks. Read accounts written by neurosurgeons. So Henry Marsh, just read his books. He has like amazing, I think he has 2 or 3 books, I'm not sure which ones. I don't know how many he has, but he has really good books, and he will illustrate what it's like to be a neurosurgeon and how he lives with the career. Because yeah, you can read about all the different procedures, you can read and learn all the anatomy, but until you understand and appreciate what it's like to be a neurosurgeon, I don't think you can say you want to be a neurosurgeon.
Yeah.
And I think that applies to all specialities of medicine. But yeah, you can read textbooks if you want, that's up to you. But I'm just saying, have a look at like autobiographies by current surgeons, or even just any medical doctors, because it will be a really good initial insight into the field.
Yeah, so I'm going to echo that. So Do No Harm by Henry Marsh, read that. It is probably, it gives you a very good account on what British, NHS neurosurgery is actually like. And I think differently, unless you've experienced a neurosurgery or done a job or whatever, it's quite naive to say I want to, be a neurosurgeon from the get-go. I changed my mind. I pursued a master's. I thought I was going to do infectious diseases and tropical medicine, and look what I am. I've changed my mind completely. So it does happen. I will say, do no harm, definitely. There is another book. There's another book by another neurosurgeon who died. What was his name? Like When Breath Becomes Air, or
When
something
Breath Becomes Air, yes.
like that. Yeah, that's another book which I really enjoyed. It's quite sad, but it's really good account, because he went to Stanford and very well educated. Another inspiration of mine is Cushing, who was a really famous neurosurgeon in America. And if you learn about like Cushing, you'll know exactly what he did. He was one of the forefathers of modern day neurosurgery. So I read his biography, and that was quite inspiring as well. So literally, what are you going to do? You haven't got a neurosurgical job. You don't need to know, how to do a decompressive craniectomy or anything like that. You don't need to know that. Just read the books, which are like accounts, I would say.
Yeah. Okay. Thank you, guys. So, I mean, a lot of these questions you've sort of answered already. Okay, but how about, so what is the route into research in medicine? You kind of answered it, but maybe talk a bit about other ways you can get into research.
I think you can start off by doing letter to the editor. I think that's the first thing that you might want to try. It's the most simplest one, because you have to, you just read the article, you see what's they can do to improve on it. And I think that's the first step a lot of medical students take before they become overwhelmed by research. And then you can work towards like reviews, systematic reviews. Audits you should probably leave for later, because it's a lot of work, and you won't really understand what you're doing at the beginning. I think start with something simple at the beginning. There's no need for you to go in and start doing clinical trials.
So I'm going to echo that. So what I did was, well, actually, I started off with bench work, which was, because I did a fully funded thing, it was quite difficult and I didn't really know what I was doing. Like I would start off, let's see, editor commentaries, editorials, those sort of like, opinionated sort of fluffy pieces are quite good to get into, because they don't take that long. If you know how to do it, it doesn't take that long. And you can make a little group and literally pump out let's see editor. Most of the time they're accepted, but just you have to really aim to what you want to publish, especially with let's see editor. They have to be topical and has to be, relevant. Otherwise it's going to get rejected. I think quite to do in research is case reports. Lots of consultants have case reports which are interesting, especially if you work in a tertiary centre, like for example Great Ormond Street or something like that, where case reports pretty much daily. You're going to see something different. So I've done case reports, I've got case reports published, and the more intriguing they are, the more likely they're going to get published. So you learn skills as well, such as taking and writing like written patient consent. Actually consenting a patient, there's an art to doing it. And you need to really convey exactly what you're going to do. So consenting a patient is really important, especially if you want to pursue surgery. It's an art to it. So getting into case reports, you get to learn that skill. And then presenting at conferences, you know, it's all that business. Audits are a nightmare. You'll have to do them later. And systematic reviews, honestly, I get bored, really bored with them. They take ages to do. There's some, you know, and you have to follow something called the PRISMA guidelines, which is a nightmare. You're sat there for hours going through papers. So unless you're in a big group, then systematic review by yourself is a nightmare. And then, you know, the likelihood of you getting into a clinical trial is very, very unlikely as a medical student, unless you know people. So that's the only thing I'd say. A lot of research is about who you know. So if you don't know anyone, do what I did. Make a LinkedIn, be cheeky and ask everyone until you get something. And it worked. Like, you know, I've published quite a lot. I've presented quite a lot. So, you know, it's just get in there and ask.
Okay, thank you. So just one last question before we finish. More of a generic question, but how can medics in medical school right now publish?
So there's a lot of medical student journals that you can start off with. The problem with that is, well, let me say the advantages of it first. So it gets you used to the style of writing that you would need to do for eventually big journals, and you get used to what you were looking for in research, how you will analyze data and things like that. The problem with it is that you don't get a PubMed ID from them. Some might, I'm not really sure, but I don't think you get PubMed IDs from them. But I think if you want to just get your foot into research and see what it's about and see if you actually are interested in it, they're a very good way to get involved in, and to try to publish in those things. So as Jack said, things like, I guess, audits, or you can do systematic reviews. They'll take a while, but you can do those things. Case reports, yeah, that would probably be my go-to for if you're starting to do research for the first time, because there will always be a strange case that, like, you're going to have them like maybe once a week. There's going to be something that not many consultants would know about, or they would want someone to write about this. But yeah.
So yeah, to echo, student journals, do I agree with them? I think it's hard because as Keneth says, PubMed IDs are what, you know, at the end of the day, if you need an application, you need a PubMed ID. So you could do a lot of work to get into a student journal, but it wouldn't be paid as better as, you know, getting into a journal. So I would say, yeah, start off with something easy. Let's say the case reports. They're quite hard to publish, actually. I remember this one case report, we had submitted to 6 different journals before it was published. So it's difficult. Letters to the editor are very hit and miss. It's really hit and miss unless you are in a group which does it all the time, has got a relationship with the editor in charge as well of a specific journal. So that does happen, by the way. There's a lot of nepotism in research. So that's what I would start off, and you know, you could start off in year 1 if you wanted to, but buddy up with someone who has published. For example, I'm in 5th year. If someone wanted to publish something, fine, I'll help. Just buddy up with people who are nice and approachable. There's a lot of toxicity in research and a lot of snakes, like people who will really, you know, stab you in the back really with it. So be very careful who you approach, because, you know, some people will steal ideas, and God, it's horrible. Brings the worst in people. Just be very careful. So just approach people like me and Keneth. We're pretty nice people, you know. So just approach us, or approach people similar, and that's what I would do.
Okay, thank you so much. Do you guys have anything to add before we wrap up?
I think just give research a go, to be honest. I think don't we've obviously said a lot about how much you can do in research and maybe overwhelm some people who's starting medical school soon or applying to medical school or worried about research. Just give it a go. Start small. You don't need to be thinking about really big projects right now. And I think, yeah, just give it a shot. You might like it, you might not. You never know until you try it out.
Exactly. For people applying for medical school, things to take out of this are try and get into master classes, try and get some work experience in lab, you know, in your interview, say evidence-based medicine, translational bench to bedside medicine, all that sort of stuff. It gives you brownie points when you actually say it in an interview. So you know, just clinical guidelines and stuff. So it shows insight. We'll just start in medical school, start small. Don't overwhelm yourself. And that is pretty much it, I'd say. Yeah. Thank you for the opportunity.
Thank you guys so much. That was really, really insightful. So I'll just take everyone to the last slide. So if you do have any further questions for either Jack or Kenneth, direct any questions to our events email at Intermed School and we can pass it along. And also, if you click on the link for Google reviews, anything that you have, any feedback you have for Intermed School, we really appreciate it. And feedback for this event specifically, if you could scan that QR code or fill in the feedback form. I sent the link in the chat as well. You'll get a certificate if you do fill it in, but it's very helpful for us and also for Jack and Kenneth as well. So yeah, so thanks everyone for coming. Hopefully see you at future Intermed School events as well. So yeah, have a lovely weekend in the meantime. Okay, cool. You guys are free to leave as well.
Okay. Thank you so much.
Wonderful.
Yeah, thank you so much for coming.
Much.